Welcome everybody, it's me, Dr Khaled Sadek, and you've tuned in to another episode of my Friday night virtual clinic. For those of you who are new to the program, I'm Dr Khaled Sadek and I specialise in the removal of cysts and lipomas, as well as being a general practitioner here in the United Kingdom. So, today we had the release of our latest video that just went live on the channel, so if you tuned in for that, thank you so much. If you haven't seen that, make sure to check it out after today's video. So today in the live chat, I've dedicated it to discussing the corona vaccine, of which lots of them have been approved, now readily available virtually all over the world, and what a timely fashion it has been, as here in the United Kingdom we enter almost a third wave, or a very large second wave of an outbreak of the coronavirus, especially the new strain, and it's affected the country in a very catastrophic way. In fact, we're into our third lockdown and a major incident has been declared as of today. That's the 8th of January 2021 in the city of London. That means that critically most beds, or a large proportion of beds, are being occupied predominantly by coronaviruses, and that hospital capacities are very close to being overrun. So, the only way out of this is, of course, to get immunised. Now, I'm going to tell you about my experience about my immunisation, why I decided to get immunised, as well as give you the facts of the different types of immunisations, the side effects that I had, the side effects you can anticipate, who can have it, who can't have it. So, no secrets, I'm a pro-vaccinator. I believe in vaccines. You will not have any anti-vaccine rhetoric here. So we're going to begin by telling you about what I had. So I went for the Pfizer BioNTech vaccine, which is a messenger RNA vaccine. It's just a little bit different to the standard vaccinations that we typically get. Now, normally in a vaccine, your body is exposed to a dead virus or parts of a dead virus. And from that, your immune system recognizes that sample of tissue that you've been given and then goes about building itself the immune response. But the messenger RNA doesn't do that. Messenger RNA, if you want to think about it, is like a recipe. It's already there, and all the body has to do is read it. And once it reads it, it knows how to build the immune system that it needs. So you don't need to give it the virus, the body of the virus itself. All you do is you give it a series of words, some text, and then the messenger RNA enters the body, and then the cells start producing the antibodies or the immune response. So that's the critical difference between the traditional virus vaccination and the messenger RNA. Now, the messenger RNA technology has been used for the Moderna vaccine and the Pfizer vaccine. The Oxford vaccine, which has just been released in the United Kingdom, is a traditional vaccine. So it works on the toxoid, that presenting the body with a sample of the virus. So what is the difference? Which one should you have? Are they safe? Do they work? So first of all of the virus vaccinations have undergone clinical trials. They've all been demonstrated to show efficacy. They work on patients in preventing them contracting the coronavirus, and they've all been very safe. However, they are not without their side effects. So, on the day of my vaccine, obviously I have to get vaccinated because I'm a frontline healthcare professional, and it's important to make sure that I'm fighting fit on the front line and not out of action, as well as protecting my family. So, very straightforward. I attended a hub in the Earl's Court area. That's where we are hubbing our vaccines, and I was administered a vaccine in my left arm. Now, the vaccine is what we call an intramuscular vaccine. That is to say, it goes into the muscle as opposed to being a subcut, which you might get, for example, in a chickenpox vaccine. So there's a slight difference there. I had no side effects initially, absolutely nothing whatsoever. But the next day, I have to admit, my arm was very, very sore. And for about 48 hours, it was exquisitely tender, and it did keep me up actually in bed the first night. However, it's good as gold. No problems now. It's completely back to normal. So that is actually the most common side effect for getting any vaccination, in fact, and that's a pain at the site of the injection, okay? And that was my only experience. I didn't have any other symptoms. However, the manufacturer does highlight 4 or 5 other common side effects, such as headaches is the number 2 side effect. Number 3 is slight muscle ache. Number 4 is a slight temperature, and as well as getting the vaccination site pain. Okay, so those are the most frequently encountered side effects, but in my case I only had the painful vaccination site. So that's the messenger RNA, that's the Pfizer. Now, because it is this messenger RNA, which is in a way a piece of DNA information, DNA is very, very unstable at room temperature, it breaks down. So the messenger RNA vaccines need to be stored at super cool temperatures, at -80. Now that's super cold. It's about as cold as you're ever going to get on planet Earth. So they have to have these special fridges. And once it's out of the fridge, you've got about 6 hours at about 5 degrees or room temperature to administer the vaccine. So you've got to work pretty fast. You've got to have the super tech ultra cool fridges, so it's not available for poor countries or anybody who hasn't got a -80 refrigeration system. So that's the downside with the Pfizer and also with the Moderna, because they're both messenger RNA and they both need super cool temperatures. With a traditional vaccine, you don't need a super cool fridge. So things like the Oxford vaccine, this part of a vaccine, the virus can be stored at a normal medical fridge at 4 degrees centigrade, so much readily available. You don't need to have specialist hubs. It can be administered at every single practice. So those are the logistics behind administering this drug. What about the efficacy? How good is this vaccine? Well, the efficacy for the messenger RNA is very high. The data states 95%. Okay. Now, the Pfizer vaccine, it's 2-part vaccine along with the Moderna and the Oxford. So you have 1 dose, and for the Pfizer, you have a second dose 21 days later, and the Moderna vaccine is 28 days later. Now, obviously, the data for full immunity means you have to complete the course. And once you complete the course, you get that 95% immunity within 2 to 3 weeks. Okay, so if we start immunizing a population from today, once we finish the 21, 28 day milestone, we have another 2-3 weeks until we get the proper immunity. However, there's a lot of controversy because here in the United Kingdom, we've decided that we don't have enough vaccines to give everybody a double dose until supplies start to kick in. So there has been a movement which has said, like, maybe we should just vaccinate everybody on the first dose. Okay, that'll give them some immunity, and then once the second dose comes in, we can vaccinate more people. So the idea is to vaccinate as many people on a single dose as opposed to have your vaccines and vaccinate a small cohort, half a population. A lot of resistance, a lot of controversy about whether or not you can get sufficient immunity within the body on a single dose, and bearing in mind that all the data has been made on the 28-day 2 doses. The manufacturer guidelines, Pfizer guideline, is to do 2 vaccines at 21 days. So what is the United Kingdom thinking by splitting the doses? Well, most vaccines are licensed for the course, but there is scientific data to analyze how much immunity you will get if you give 1 single dose compared to 2. And the data states that after day 14 of a single dose of either of the Pfizer vaccine, you can get on average a 50% immunity level. However, there's a spectrum, and that spectrum lies between some people getting only 20% immunity and some people getting 70% immunity. That spread of people getting the lowest level of immunity and the highest level of immunity is what we call in medicine the confidence interval. And in the middle of the confidence interval is our average. And the average is about 50%. However, it can be as low as 20% and it can be as high as 70%. So the data indicates that the confidence interval is very broad. It's almost 50%. So, the data isn't as strong. So that's the philosophy behind giving a single dose. Okay. Now the Oxford vaccine is a 28-day vaccine, but has a slightly longer policy. It can be given up to 3 months. So what do we know about vaccines in general and the duration of the interval? Now, we know that all vaccines have a period in which you can't have it too soon. So if you have it on day 1, don't come back day 2 for the second dose. We always have to give the body a level of time to develop an immunity. It has to look at that piece of information, develop the immunity, and then with time, once it's developed it, we give it a bit more, and it goes, oh yes, I remember it. Let's keep going. So in fact, there's some evidence to say that if you increase the duration of the first and the second, you develop a stronger immunity. So that's another thing to consider as well. However, by doing that, you of course have a suboptimal immunization level and increase your risk of developing an infection. Okay, so that is the background information on the vaccines. Okay, but is it safe for everybody? Can everybody have it? Who can't have it? Can pregnant women have it? Is it evident in breast milk? Can children have it? All these questions we're going to answer today. So first of all, there's limited information with the Oxford vaccine about giving it to people over the ages of 65, just because the population that we tested it on was relatively young. It's from 18 to 65, and most clinical trials do focus on that age group. So there's very limited data on populations above 65, and also there's very limited information on populations below 18. So children and the elderly, but we're still going ahead and we're giving it to the vulnerable. Okay, that's number one. We also have limited information on its effect on pregnancy, although we have some animal studies that have shown that actually it's safe. It's safe, okay, but again, there's no clinical data. We also know that there's a little bit of evidence to show that some of the vaccine is present in breast milk. So those who are breastfeeding will also need to take that into consideration, okay? However, we don't know what the long-term effect of that is, but it's just there. Now, there are some certain groups who can't have it at all. At all, you can't have it. And one of those is those with severe allergic reactions. So if you carry an EpiPen, if you have an anaphylactic reaction, then you must seek medical advice before going ahead and getting that vaccination. So number one, if you have allergic reactions. Number two, you've got to be particularly careful if you are prone to bleeding. So if you're on a blood thinning medication like warfarin or apixaban or any other form of NOAC, you've got to be careful. If you're on an injection like clopidogrel, you've got to be careful. And also those who have an inherited condition which results in increased bleeding, like if you're losing some of the elements that stop bleeding. So platelets, we know that platelets help to produce a clot, but if you're lacking in platelets, you can't produce a clot. And for those individuals who go on to have an intramuscular injection, you may be at risk of bleeding intramuscularly. So if you've got a thrombocytopenia, if you're on anticoagulation, then there may be issues on that, okay? So those are the two categories for contraindication. So severe anaphylaxis, and you've got to be careful if you have a clotting disorder. Okay, so let's move on. Let's have a look. I've got my notes in front of me because there's only so much I can memorize. Okay, so actually we've covered everything. We've covered it all. So that is the basics for understanding the vaccine profiles. So there are 3 vaccines on the market, and I believe the Chinese also have a vaccine available as well, but it's not. I don't believe it's available in Europe and the States. But in essence, you've either got the messenger RNA, which is a recipe for your genetic machinery to just follow it out, make a cake, or to do the traditional way, and you present to it the cake, and then it eats it, and then from there it learns. So those are the 2 options. Which one do you go for? Well, in most cases, you won't really have a choice because your government will have a stock of one or the other, okay? And if you are at a position where you could choose, well, it's a personal preference. It's a personal preference. They're both safe, and they both give a relatively equal amount of protection. Okay, so I hope that's been informative. So let me take some questions. I've spoken a lot, but let's hear what everybody has to say. So put your questions in capitals, and then I can identify it much, much quicker. So let's have a look. So Gibby's wife asks, I've noticed that those who said they've had the vaccine, they sometimes have a bit of a runny nose. Okay, so you can't contract COVID-19 from the vaccine, obviously, but you may get some side effects. Now, having the chills and the muscle ache, yes. Runny nose, not so sure of. It's not. It might be in the sort of the less frequent ones, but you're not going to develop COVID-19. Okay, let's have a look. I had headaches for a few days, and it's into the second week. So that's Sunday Nelson. So she's telling us about her experience. So remember, side effects, second most common feature. What about those with autoimmune disorders? Okay, well look, it's not a live vaccine. Okay, so those who have autoimmune disorders, they've got an immune deficiency. So if you were to give them a live vaccine, for example, chickenpox, then they won't be able to you won't be able to fight the infection, and therefore you're going to make them ill. So you don't give people who are immune deficient a live vaccine. You can give them a dead vaccine, and you can give them a messenger RNA vaccine, because the messenger RNA is not an exposure to the virus. Remember, it's the recipe, and if you give them the dead virus, it's not active. It's inactivated virus. So you can give it to, very good question, we can give it to immunodeficiency. Next question from Nancy. If one had COVID, how long before they can get vaccinated? Very, very good question, Nancy. So the guidelines say that if you've got a high temperature, you should not have the vaccine. You should wait 4 weeks. 4 weeks. If you develop COVID, you can't have the vaccine for 4 weeks. If you have the first dose and you go on to develop COVID, you can't have the second dose until 4 weeks after. Okay, so bear that in mind. So if you've got a temperature recently, you're going to have to wait 4 weeks. So severe temperatures, 4 weeks. COVID, 4 weeks. Okay, very good question. Question that's been asked a lot. Wow, loving the questions today. Let's have a look. If I miss, there are so many people today. If I miss it, then just keep shouting it out. Let's have a look. What about someone with Crohn's disease? That's from Lucy Norman. So Crohn's disease, as we know, is an inflammatory bowel disorder. Obviously, those who have these conditions may be on immunosuppressants. So they may be on medication that suppresses the immune system, such as azathioprine or methotrexate. In those cases, yes, you can have the messenger RNA vaccine, because remember, it's not a live vaccine and they should get it to give them the protection. So those who are the most vulnerable, so the elderly or those who with comorbidities of multiple illnesses, they should be first in line. Sandra Goody says, hi, do you think that the vaccine will work? It's a good question, Sandra. So we know that this vaccine is very good on the coronavirus that we had from 2019 through to the summer of 2020. We know that it works against that vaccine. What we don't fully understand is it going to be as effective against the new strain that the United Kingdom, that South Africa are particularly getting exposed to, and only time will tell. At the end of the day, we have no other vaccines available to us. So yes, it should work, because the mutation has meant that the virus hasn't changed massively in terms of the immune reaction that the body develops. So the spike protein, that is to say, the part of the virus that presents to the body, still kind of looks the same. So like if you see a bad guy and he shaves his mustache, you know it's still a bad guy, right? So the virus hasn't changed too much, okay? So the spike protein hasn't changed. So the idea, that the theory is that it should be efficacious, but I've also heard that the virus vaccine can be tweaked very easily and then put into circulation again. So they can, update the virus vaccine quite quickly. And this is what we do with seasonal influenza every year. We do modeling and try and predict which vaccine we need to develop, which strand of virus is going to be prevalent in the winter, because it takes us so long to get the medication. Okay, great question, Sandra. Love it. There's so many questions today. I'm allergic to the flu vaccine. Will I be allergic to COVID-19? That's Kim. So those who are allergic to the flu vaccine, are they able to get COVID-19? So look, the issue with the flu vaccine is that it's incubated in eggs. Okay, so that means if you're allergic to egg protein, you can't have the traditional influenza vaccine. Okay, so you can't have the intramuscular one. but the COVID-19 isn't incubated in eggs. Okay, so you should be okay. However, that said, if you have an anaphylaxis to anything, then that may preclude you, but you have to speak to your local physician to get more advice on that. So if you're just allergic to eggs, then that should be okay, but speak to your clinicians about that. Almost 200,000 subscribers. How many subscribers have we got? Let's have a look, because I think this weekend we're going to break 200,000. Let's have a look. Where are we today? I'm going to look online. We're on 199 and 700, so 199,702. So we are 300 short of 200,000. So fingers crossed. Okay. Right, let's have a look. Who else do we have here? Let's have a look. So quick questions. What about senior citizens? Yeah, they can take it. Is there a sulfur in the egg that? What's this? So is there sulfur in it, or is it an egg-based vaccine? I don't believe it's an egg-based vaccine because it doesn't need to be incubated. It's a messenger RNA vaccine. So you just make the messenger RNA and then you put it into a nano protein and then you deliver it. Okay. So there's no egg in the vaccine. Okay. I've heard that 28 days after isolation ends, you can have the vaccine. Absolutely. So it's 4 weeks. 4 weeks post-infection. For people who stay at home, should we get it at all? Bambi Lynn. So at the moment in the United Kingdom, we're doing vaccines for those who make it to one of the hubs, so one of the vaccination centres. We're not doing homebound vaccinations. So if you're homebound, you're not quite on that criteria yet. However, once the, like I said, once the Oxford vaccine is readily available and you can store it in a cool chamber, a cool box, then we can get our district nursing team to go to people's homes and give the vaccine as and when it's needed. So the Pfizer vaccine is not suitable for the home service because the cool chain, it needs to be kept at very cool temperature, isn't guaranteed. But the Oxford vaccine will be able to do that. So yeah. Next question. I'm on antibiotics full time, 2 different types. Will my antibiotics interfere with the vaccine? That's from Elizabeth. No, it won't, Elizabeth. That's fine. If you're very allergic to meds, should I take the shot? Vida, you need to discuss that with your physicians. There are issues about anaphylaxis. So it depends how severe your allergic reaction is. Loads and loads of questions. Dr. K, I take 2 allergic shots weekly. I carry an EpiPen, not food allergy, just many other things. I'm a little concerned that I'll have a reaction to the vaccine. Gail, right, you're rightfully so. You got to be careful. So just double check with your local provider. Make sure you all hit like. So many wonderful questions. Let's just remember, write them in bold if you have questions, because there are loads and loads of questions coming in. Let's try if I can get some here. In fact, get your questions in. I'll have a read of those. We'll go to an intermission. I'll have a read of the questions, and then I'll bring myself up to speed. Welcome, I'm Dr Khaled Sadek, and you're watching my fantastic world of cysts and lipoma removal. Welcome, I'm Dr Khaled Sadek, and you're watching my fantastic world of cysts and lipoma removal. I'm Dr Khaled Sadek. Welcome to Medical Mysteries. Every Friday at 9:30 Greenwich Mean Time. Wow, welcome everybody. Wow, I've been reading the comments that have been coming in, and oh my gosh, have we hit onto a stonker of a discussion. So many questions, keep them coming in. I've picked up on a few, and so I didn't write the names, I just wrote the questions. So one came in, will it affect my DNA? Now this is something that's kind of been in the ether, shall we say. There's a lot of controversy. Has Bill Gates put a nanochip? Is he going to monitor you? Are they going to track you? Are they going to change your DNA? Am I going to turn into a bat? I had the vaccine and I'm fine. Okay. Now it does not change your DNA because you're not injected with any DNA. Okay. Nothing is attached to your DNA. Nothing is spliced into your DNA. Your DNA is not even touched. They don't touch your DNA. Okay. Your DNA is locked over there. Okay. What they're injecting you with is something called messenger RNA. Now, I'll explain this briefly because I think it's important that we explain this. DNA, if you remember Watson and Crick, they developed this lattice, what we call a double-stranded helix. So there are two strands intertwined with each other and they make this spiral. That is called DNA. It's DNA because it's dinucleotide acid. So it's di, so it's two strands. Okay. Messenger RNA is ribosomal. It's basically a single strand of information. It's not double-stranded. It's not DNA. How does your body understand to read DNA? Well, what it does is it opens up that sequence of DNA and it reads the words and it copies the words onto a piece of paper, and it takes that piece of paper to the kitchen, and then the kitchen makes the protein. That's how DNA works. And then the DNA closes again. Do you understand? So the DNA opens, the body looks at it, it doesn't touch the DNA. It just copies what's there onto a piece of paper, takes the paper to the chef makes the cake. That's how your body reads DNA. What this vaccine does is it basically produces that piece of paper, and it just takes it to the kitchen. So it doesn't even bother to look at your DNA. It's not interested. All that they've done is that they've created a piece of paper to give to the kitchen. Okay? So people think, oh my God, they're talking about DNA. They're going to break my DNA. I'm going to turn into a frog. It ain't going to happen. Okay? Messenger RNA vaccines are the piece of paper that your body normally transcribes the information in the DNA to pass it to the kitchen, and all they're doing is they're giving you the piece of paper already and just take it to the kitchen. You don't need to open the DNA. Okay, so that is the basic understanding of messenger RNA vaccines. It's the piece of paper to take to the chef. Okay, so I inject you with a piece of paper and your body takes it, scuba douche, it's done. Okay. Anxiety and vaccines. People have a lot of anxiety and therefore they're frightened to get the vaccine. Like, I tell you what, I've been speaking to patients a lot this past week, and I've been picking the phone. I've been telling them, listen, we've got the vaccine, come and get it. And you know what they say to me? Doc, I'm not sure. I don't want it. I've read this, I've read that, I don't want it. That's what they tell me. Okay. Then they call me 2 days later and they say, oh, I've spoken to my family right? This is a true story. I spoke to my family. I want the vaccine. Book me in. I book them in. Okay? 2 weeks later, the same patients call me and they say, Doc, can you make sure, please, make sure I get my second vaccine. I'm so stupid that I didn't get the first one, that I even thought about not getting it. And now I'm worried I'm not going to get the second vaccine that is going to run out. Okay? So once you get over the initial anxiety, right? Trust me, there's nothing to it. Everyone is going to be getting that vaccine. Don't miss out. Okay? So that was my experience. A lot of people hesitant about the vaccine, and when they do get it, they want to make sure they get the second one. Lupus, HIV, methotrexate, heart conditions. A lot of people saying, I have lupus, I have HIV, I'm on methotrexate, I've got a heart condition. Messenger RNA. It does not affect your immune system. It's that piece of paper, okay? It doesn't affect your immune system, okay? So it doesn't affect lupus, HIV, methotrexate, heart conditions, okay? It's gone. The only conditions were the anaphylaxis and the coagulation, okay, the bleeders, okay? Anything not to eat or drink? No. You can eat, you can drink, do whatever you like. Get the vaccine. Is it 4 weeks from the beginning of the illness? Yes, 4 weeks from when you test positive. And what is that? I can't even read my own writing. This is such a medic. I can't even read the last point. If someone can tell me what that last question was, I can't even read my writing. I give up. Listen, guys, we've had a fantastic evening. So much information. If you want more information on the COVID vaccine, we'll do more. But I think we've got to wrap up for today. Thank you so much. This weekend, we're going to be celebrating our 200,000 milestone with some special videos. Until then, make sure you stay safe, and I'll catch you all on Sunday. Until then, take care. Bye-bye.